Okay, here we go. We're getting better at this every week, I think. So welcome to our May 13th edition of Community Circle Conversations. I am Brianne Sanchez here with the Community Foundation. AJ, welcome. I'll ask you to just turn your video off until we call you up later in the morning in just a few minutes. I'll go through our housekeeping information again today. If you would take a moment now or right before we head to breakouts to indicate your desired breakout room. The best way to do that is to change your name in Zoom and put a number in front of your name. Each of the rooms are numbered. We'll have Anne with Impact Community Action Partnership, Matt with Iowa Stage, and Cameron with the YMCA of Greater Des Moines. Creating Space. They're all wonderful people who I am privileged to know. So just look at maybe which best aligns with your field of interest, and we'll have some good conversation in the second half of our morning. So it looks like we're still welcoming quite a few people in. So we'll give folks another minute or two before we head into our agenda this morning. I kind of feel like, I don't know, this is silly, but you know, when you're waiting for a bag of popcorn to pop in the microwave and you can like hear the kernels, and then it kind of slows down and you'll get one and one and one, and then you know like it's time to, if it hasn't beeped yet, pull it out. That's kind of how I feel, because I get a ding every time somebody comes in to the meeting. So I'm like waiting for the kernels to slow down a little bit and stop popping, and then then we'll move to our next slide. And I think we might be at that spot now. So Bridget, if you could take us to the next slide here. I will just go through our agenda today. So we are fortunate to have AJ Mumm from Polk County Emergency Management joining us today. And really the theme of what he's going to talk about with us is community response, recovery, and the path forward. So, you know, we've been kind of trying to figure out how do we frame this month of meetings together, and you know, there's interest in what's next, and AJ is really on the ground, and Renée Miller will introduce him, but he's really you know, behind the scenes doing a lot of coordination. So it'll be really great to have him with us today. And then we'll have our breakout rooms, which I kind of described. We'll have 3 different hosts, and I'll pull their names and numbers up again as we transition. And then this will be actually our last week with Dustin Miller doing a presentation on policy in our other room. So that is going to be a great opportunity for folks. If you want to stick around in the main room, you're more than welcome. We do record it and post it to our page every week. So that is an opportunity. And I also wanted to call out the Ask line. The Ask line, I think, will be in maybe its last week or two. So if you have questions and you want some one-on-one time with Dustin, that is completely free. You know, we, as the presenting partners that you see on the right of your screen, have pulled together to make that resource available to you. So we'll make sure that the Ask Line information is again in the follow-up email today, and take some time to go ahead and request time with Dustin if need be. So we're just wrapping up on that. Obviously, you know, as funding partners, everybody is really open to listening to what you want more of, and what resources you need, and making connections. So don't hesitate to reach out to any of your contacts at the foundations listed to the right. The leaders are excited to, you know, work with you and connect you with resources that you need. And listen, sometimes maybe you just need somebody to listen, and we can do that too. So let's move along to the next slide here, and I'll invite Renée Miller. Renée, I think you have like new camera capabilities now, which is so exciting. So Renée, if you just wanted to kind of tee up AJ and then invite him to share his screen, and we'll get going on that. Thanks.
Yeah, thanks, Brianne. And I loved your popcorn analogy. I think that's really, that made me giggle. So thanks for that. As Brianne said this morning, well, and I should say good morning to everyone, but this morning we really wanted to spend some time sharing a little bit of information about what's happening both at a community level and then with some of our colleagues who are really starting to think through what or imagine what it may look like to kind of reemerge into what will be our next normal. And while there is still a lot of uncertainty about what our future looks like, there is a lot of great work and many efforts that are underway to start thinking about what does our resilient community look like as we reemerge from this crisis. So we thought today we would start by hearing from one of our very own response and recovery experts, AJ Mumm. He has been with Polk County Management since 1999, and AJ, you will have to correct me if I'm wrong on that. But since 2004, he has served as the director of Polk County Emergency Management, which for those of you that may not be as familiar, is really the lead organization that's responsible for coordinating and supporting activities that really help our community both prepare for and respond to disasters when they occur, and then also recovery. And that's really what we hope to kind of think through and talk about a little bit this morning. I've had the privilege of getting to know AJ over the past several years as we've worked together to respond to several community issues. And I will tell you that you will not find anyone more committed to emergency preparedness, response, and recovery than AJ. He is an incredibly collaborative leader and really understands the complexities of crisis like the one that we're facing, even though this is unprecedented. So what you'll hear from AJ today is really kind of a framework for what that response and recovery path looks like. And he'll talk a little bit about the resiliency work that emergency management is leading as we begin to think about our recovery as a community. So AJ, without further ado, I'm going to turn it over to you. Thank you so much for joining us today, and we'll appreciate hearing from you.
Thank you, Renee. Probably one of the best introductions I've ever had. That was awesome. Thank you very much. And it's been great to get to know you, and we look forward to working with you moving forward. I know we all have a lot of work in this line of work. There's usually never a shortage of work to be done. So we will be in the now and do everything we can, but always keep an eye on the horizon. So again, thank you for having me. Thanks for the work that all of you do. It's been great to be a part of this community. I first came to Des Moines as a freshman at Drake University back in the early 90s, and have been here ever since. So now a proud member of the Central Iowa community for quite a while. My capacity as the Emergency Management Director is challenging, but also extremely rewarding to get to work with a lot of different entities. So I'm not sure if you want me to share my screen. I have a couple slides, or if they were embedded in the presentation. Yeah, excellent, thank you. So with this, just wanted to kind of put this into context. I'm sure everyone is at least familiar with some of the items on this timeline, but we go back to mid-November when there was the first report in Chinese media of this virus, this disease in the Wuhan province. It was late January when the World Health Organization declared a global health emergency, and it was one day later that locally we met with our response partners and said, hey, we've been seeing these things occur internationally. and it's probably a good idea to inventory your personal protective equipment. Just, go back to your storeroom, take a look at what you have, and if you need additional, you probably should think about ordering more. That was really our guidance, no more complicated than that in late January. Well, then, as you probably remember, the Diamond Princess cruise ship was quarantined in early February. And as we saw the developments of that occurring, it was on February 26th that the Polk County Health Department and myself met with the Board of Supervisors and said, this is something we need to pay attention to. Gave them a little bit of the background of what we had done in terms of the PPE, the personal protective equipment. The Board of Supervisors supported that, and have been very supportive from that point forward. I guess it would have been March 6th that the health department and EMA, we met again to sort of phase out this, what our response might look like. And we identified a readiness and monitoring phase that we had already been in to that point, and really looking forward and committed to each other that we need to stay one step ahead of this. So if we're in the readiness phase, we needed to be planning for and ready to execute that hotspot and detection isolation phase next. And of course, that came to fruition. And then once we were in that hotspot phase, then we said we need to have a plan and be ready for the community spread. And of course, that played out that way. And again, it's not that we're that smart. It's just that it was that's the business we're in, and we had a responsibility to always stay a step ahead of the disease and the level of outbreak that we were in. And so the Emergency Operations Center actually opened on March 9th. And so we have been going steady ever since then. So the Emergency Operations Center has had some level of activity every day since then. Some days have been longer than others, but just getting into what we call a battle rhythm. It's just a routine where we come in each morning. We have a briefing of all of our response partners. I'll show you that here in a second. And from there, we take what might appear to be a giant problem and start breaking it down into smaller and smaller parts until those pieces are manageable. And then we assign individual segments of that problem out to individuals that have the resources and the expertise to deal with it. And we work with each other, as Renee said, in that collaborative manner to break down what might look like a Godzilla-sized problem into that tiny little Geico gecko that's manageable. So that's the way we approach it. Next slide, please. So here are 16 objectives. We practice management by objectives. It's a business management principle that's universally accepted, and here in emergency management, we embrace that, and it allows us to stay on track because there's opportunities for distraction at every turn, and if we can clearly identify what we want to do, these become our objectives. The how we do it become individual strategies. Then we assign that work out, like I mentioned, put resources behind it, and stay in communication with each other, and adjust our objectives as the problem moves from being one of where we're reacting to it to one that we can eventually become proactive, identify issues in advance, and mitigate those. And so you can see here the 16 objectives. First and foremost was protect the public. There's just no doubt of which one of these 16 objectives is the most important, and that's obviously number one, protect the public. And there's a lot of risk-based mitigation measures. Hopefully you all can recite them by now, right? It's the wash your hands, cover your cough, wear a mask, social distance. All of those are mitigation measures. And again, emergency management's not the subject matter expert in those, but we bring on board those that are, and the Polk County Health Department has been every bit of that subject matter expert. Emergency management is a lot like a orchestra conductor. We don't play a lot of those instruments, but we know who does, and we know who plays those instruments really well. We get them into the room together. Most disasters, we love to have them here physically in our emergency operations center. For this particular response, it's been a little bit of a hybrid. We do have a very large, relatively large emergency operations center, so we can practice a lot of social distancing, and we all wear masks when we're in a room together. But it has been a much smaller group than we would have, than you might have seen for the flash floods in 2018, where we might have had, at some points 80 to 100 people in the room, all doing their job, all at that command center, all doing, their work. Where this one's been a lot of Zoom meetings, a lot of conference calls, some small groups getting together every day, but then limiting our time together, and everybody kind of breaks huddle and goes off and does their part of the work. Our focus has always been on the public, but also right next to that is the healthcare workers and responders. Number 3 is we have a responsibility to get information out to the public, and our Joint Information Center has been led by Nola Agner-Davis with the Polk County Health Department, and she's done a remarkable job of organizing a lot of information that changes so quickly, and getting that information posted to a reliable source, and then being available to the media to talk about that, to interpret that, to explain, to provide that messaging to the public that hopefully resonates with them and causes them to take action or avoid action if that's the appropriate response. And just as important as information out to the general public is making sure that all of that CDC guidance, that Iowa Department of Public Health guidance, that there has to be some level of interpretation for our response community. Central Iowa EMS directors, the hospitals, all are asking questions about, well, how does that impact us? What does that mean to us? So the Emergency Operations Center becomes a resource for them to inquire, to have that issue be analyzed and a coherent response shared back out with them. Our Medical Coordination Center has really been one of our big wins. This is the Medical Coordination Center. Think of it as a hub within the Emergency Operations Center. So these particular folks are representatives from all of the hospitals and health systems across Polk County and the Des Moines metro area. It's Central Iowa EMS directors. It's the Polk County Health Department. They are all coordinating because they're looking at things like healthcare workers, the adequacy of the number of healthcare workers, the number of beds available, the amount of PPE available to healthcare workers. They're all focusing on making sure that those resources are adequate, that we know almost hour to hour what the status of those resources are. So twice a day we'll get an update, and a pretty simple status system. Green is good, yellow is that there are some questions about capacity or capabilities, and once we get into red, then we're obviously trying to avoid being into red, but that would mean that there is some level of surge that we don't have adequate resources for. The good news is that we've been in green predominantly. A couple times we've ventured into the yellow status. There's some work that gets done, some resources reassigned, and we go back to green. And so that's their job, is to constantly think of it as somebody at the switch of, are we going too fast, too slow? And we can allocate resources directly through the Medical Coordination Center and their direct connection to the hospital systems, public health, and pre-hospital emergency medical services. This is new for a lot of us, so there's a lot of new legal implications. And so the Polk County County Attorney's Office has been outstanding in interpreting, every one of the governor's proclamations, need to be interpreted in what that means to us within local government. And so they've been outstanding in getting us that feedback every day on what that means. And number 7 is really complete at this point, but this was one of our fairly intense early objectives when, if you remember, we had a number of Iowans that had been traveling abroad, many on these cruise ships, And so the process to repatriate them safely for their own health and for those that were going to welcome them back home. And so to our knowledge right now, that all Iowans that wanted to return have returned, so that objective is mostly complete. We leave it on there because of additional, the second wave planning that you might be hearing of, that this, we may get to a place where there is more international travel, and if the second wave occurs, we might need to refresh that one. With all of this, there are mental health impacts. There are a lot of vulnerable people in our community that respond to these types of crisis they have a hard time dealing with that. And that's one of the things that Polk County Health Services, which is different than Polk County Public Health. Public Health deals more with the physical health. Polk County Health Services deals with the mental health impacts. And Health Services is led by Liz Cox. She's done an outstanding job of keeping the mental health issue in front of us every day. And so everything she sees and hears at the EOC, she's looking at it from how does this help or hurt us from a mental health standpoint, and works with the community and a lot of providers across Polk County to make sure that the mental health of people in Polk County is at the forefront. Renée is keenly aware of volunteer engagement, and United Way has been an outstanding partner for a long time, not just for COVID, but disasters as far back as I've been involved for the last 20 plus years. United Way of Central Iowa has done a great job, and we lean on them a great deal to help us attract, manage, and distribute volunteers to do their work. This one's a little bit different because in a windstorm or a flood or a tornado, volunteers make themselves known that they're willing to volunteer. We organize them. We say, here, go pick up this stuff and put it here. And they do a lot of great work. This one's a little bit different. That's not a clear cut, something to go and do. And so we've seen a lot of volunteers do very simple but meaningful gestures, making masks, making signs, organizing the birthday parties, the drive-by with the police departments and fire departments. There's just a lot of that going on. And so we consider that volunteer engagement. We've had hundreds of thousands of donations. I've got a slide here in a second that would give you an indication of the amount of donated supplies. So I'll talk about that in a second. Tremendous amount of logistical support. Again, there's a slide coming up, so more on that in a second. Everything we do, we're mindful that we are stewards of public resources, right? So we're using tax dollars. Your tax dollars, my tax dollars are at work here. And so making sure that we have clear objectives like you're seeing here on the screen, and that all of our costs are related to accomplishing these objectives. And so it helps keep our costs down, and it provides the documentation and justification for every penny that's spent. How did that contribute towards our objectives? And so there's just a lot of the accounting and the auditor's office here with Polk County help us a great deal in making sure that our expenses match a benefit, and that benefit is to the public. The Continuity for Emergency Services, we meet regularly with the Polk County Fire Chiefs Association, Central Iowa EMS directors, and the Polk County Law Enforcement executives. And so, as well as our three dispatch centers, our three 911 centers here in Polk County. And we want to make sure that they have the ability to continue to operate. So mitigating this virus and having that have as small of impact as possible on all of those services, allow them to continue the services we all depend upon. So when we call 911 and we have an unrelated medical emergency, we have the need for law enforcement, or we have a fire, that they're available and able to respond. And they've done an outstanding job of putting in place ways to communicate with each other. Mutual aid agreements have been in place for decades, but just checking in with each other to make sure that we don't have an impact on our emergency services. A lot of what we're doing on the with those experiencing homelessness has been working with the homeless shelters across the metro area. They have said that the homeless shelters are routinely very full. And so one of the things that we've been able to do is provide hotel rooms, again, working with hotels across the metro area that said, hey, we have a lot of rooms available. We're willing to offer them, at a reduced rate. And we've been able to move people out of the homeless shelters into hotels. That opens up a little bit more elbow room, so we are able to practice that social distancing within the homeless shelters. The other part of this is a voluntary isolation shelter at the Iowa State Fairgrounds. Eric Kuhl with Polk County Community and Family Services has been leading that effort for us, and he has helped establish a location at the fairgrounds that somebody that may have tested positive for COVID can go to the fairgrounds. And again, we have staff there that provide the comfort and care for them out at the fairgrounds, and that way we're not reintroducing, or we're not introducing somebody that's tested positive back into a homeless shelter, that they're able to go to the fairgrounds and have a place there. Our Dr. Joshua Akers, our Polk County medical examiner, works with us every day, gives us updates on trends and fatalities, and a lot of times that's updates on suicides and overdoses and how many COVID cases have come through. And so he helps convene a group of the funeral home directors, and so we meet weekly with them and talk about what the funeral homes are seeing. And so we don't want to overwhelm the medical examiner's office or any of the funeral homes or the hospitals. And so they give us an update every day, or excuse me, once a week on what their experience has been and what their upcoming week looks like in terms of funerals. And I know it sounds, some people are a little bit uncomfortable with this, but our morgue capacity, we need to make sure that we're not overwhelming our morgue capacity in the metro area. And so far that's been, we've been able to keep that to a manageable level. And then lastly is the recovery plan, which I'll talk more about in a second. So you can go ahead to the next slide, please. So I spent a lot of time on our objectives, but that's really, if you ask, well, what are you doing? Well, again, because we do this management by objectives, that is what we're doing. And one of those things that I touched on was logistics and donations. As you see here, we're dealing with hundreds of thousands of units of items: masks, gloves, gowns, face shields. That table on the left is gives a snapshot that's as of a couple days ago, but those numbers continue to climb. I mentioned donated items. As of the 12th, there were 250,000 units of donated items. So 250,000 items that have come from, some places like places most of us probably wouldn't have thought of, like tattoo parlors that said, hey, we're going to be, we really can't do business for the next couple months, and so here's, a case of gloves. And so those become those same gloves that our tattoo artists use are what our medical providers would use. So things like that have occurred routinely. It's been very heartwarming to see the generosity of our community. And one of the other things that we need to be very aware of from the very beginning was what's the prioritization, because it was guaranteed that we would have more requests than we had resources to provide. And so doing that in a prioritized way, making sure that that prioritization was very transparent to the entire community. And that's the table on the top right-hand side of the screen. I think it seems fairly obvious, but when we're so close to it, it might seem that way. Hopefully you see it the same way, that the hospitals, the medical providers, the congregate living facilities are our first priority. EMS, law enforcement, our community lifelines like water treatment, wastewater treatment, electrical utilities, all of those things that we rely on and depend upon, and just assume are going to be there for us rely on a lot of people, and those people also require the PPE to do that safely. Number 3, the long-term care facilities, but as soon as they have an identified case, then they get elevated to a priority 1. Also there on the number of organizations that we've assisted, you can see close to 150 different organizations that have benefited from our single point resource ordering process here in our logistics section of the EOC. And those numbers are a little bit misleading, because if you look at nonprofits, for example, it says 8, but our logistics section chief tells me that that those 8 are then a lot of times coordinating on behalf of other nonprofit organizations. So there's a multiplication factor there of of one nonprofit maybe helping 3 or 4 others, and so those numbers are at least 148. It's probably closer to 200 once you start adding up. Next slide, please. I'm not going to go through each and every one of these boxes, but those objectives that I discussed, we need to organize ourselves in a way that there's a span of control. These leadership principles, we can thank the military for doing this for decades, and so we operate in sort of a paramilitary kind of organization where we have an incident commander, we have operations section, logistics section, planning section, finance admin section. So Helen Eddy has been our incident commander and done an outstanding job. Helen is the director of the Polk County Health Department, and I report to her as the operations section chief. And as the operations section chief, you can go to the next slide, please. There are a number of entities that these are the doers. These are the people that are getting the work done every day, from our Polk County Public Health Group that does the traditional public health disease tracking, testing, surveillance. The Medical Coordination Center is under the Healthcare Group, and Franny Medeiros does a great job of coordinating them. You see there that 211 is a subset of that. 211 has been, they're another huge win for a lot of reasons, but they're able to get all of this information that we have out to the public. They've also then provided us information back and sort of a analysis of the types of calls they get, the number of calls they get. That gives us information to know if there's areas that there's community concern that haven't been adequately addressed. So we thank everybody at 211 for helping us do that. And the rest of the groups there across the board all tie back to those objectives that I mentioned. Next slide, please. On the recovery side, we have a recovery organization that is taking shape. It's probably a little easier to see on the next slide. So this path forward, we have identified a number of areas that need addressed, not just the physical health, but mental health. The financial health of our community is extremely important. And so we're partnering with the Des Moines Partnership, as well as Safeguard Iowa Partnership, the work that they've done in the Capitol Crossroads, the Community Foundation, all of that, and many of you are a part of that financial piece there. The basic needs seem, that these are really at the core of what our community depends upon, is housing, food, childcare, schools, financial security. Without those basic needs, it's tough to move forward into the other ones. And then government plays a role. It's sort of sprinkled in a lot of different things. But what I would point out on this is that there are so many interdependencies that reopening business a lot of times depends upon schools and childcare, just as one example. And so those interdependencies, those interrelationships among these areas are very important to recognize. So what we're doing is we're asking representatives from these organizations, and those organizations will expand. We'll add additional members to each of these lists as we move forward. But as a starting point, we're asking these organizations what they're hearing and seeing from their constituents, from their members, and basically harvesting that information and then connecting them back to the resources and knowing that path forward as we move out of response into some stabilization process. And then from stabilizing into, as we move towards growth, we want to build in resiliency so that the work that we're doing now is not just a one-time effort. The work that we're doing now, we build in that resiliency so that we're able to better endure the next pandemic, the next flood, the next financial crisis, whatever that is, that our recovery plan is addressing any types of disasters moving forward. So I think that kind of wraps up where the comments I had prepared. The next slide, I think, just talks about the Disaster Recovery Fund, and many of you are keenly aware of that. I definitely know that Renee is. And so we're extremely grateful for the foresight that many in the community had to come together and identify a resource like the Disaster Recovery Fund so that the most vulnerable in our community can have access to the resources they need to fill those gaps.
Thank you, AJ. Just a few takeaways. I love that you kind of added or ended on that note about resiliency. The second half of our days together, our mornings together, are typically spent in breakout rooms, and so we'll talk a little bit about what that means and that response, stability, growth, resiliency. I know everyone has been trying to figure out what's next, how do we know what's next? So that's really helpful. I also loved the Godzilla to Geico Gecko. I'm stealing that for the next time that there's something really challenging that we want to kind of break down and make it manageable. So thank you for spending time with us this morning, AJ. I did have in the chat box, I added a link to the 211 updates portal. So our nonprofit partners, as services continue to evolve, you can not only provide updates around your services, but also around your continued challenges. There's sort of two sections of that portal. One of the sections will update the 211 staff, and then the other section really is being looked at by that disaster recovery fund team to try and determine what needs are out there or what is evolving. So I'm seeing another question. For nonprofits needing PPE, they should email to request through logistics at Polk County. Is that correct?
Yeah, the email address is logistics@polkcountyiowa.gov, and I'll type that into the chat box here in a second.
Perfect. And then there was kind of one more question about sort of this national news around Polk County being a hot spot or growing, and how, I guess there's a question in here about who do they ask about this issue, or what's and that came just to me. So can you speak to that a little bit?
Yeah, I think it's directly related to testing, right? So the more that we test, that percentage stays pretty steady in terms of the number that are tested that test positive. And so the more you test, the more positive cases we're going to have. And so that's really kind of a proxy, the testing. Then we can relate the number of positive cases to the percentage that require hospitalization and more advanced care beyond just staying at home and drinking fluids. And so that, again, the whole flattening the curve is related to testing, and a percentage of those tested are positive. Those that are positive that require hospitalization, those that are hospitalized have an impact on the capacity of our hospital systems. So that's how those are kind of related together. And so the number is going up. It's not surprising. The other thing is, somebody always asks, when are we at the peak? Well, we don't know where the peak is until you're past it and looking back and seeing that you've been there. So I wish I had a better answer for that, but that's what we've learned on the health side.
Thank you so much. And
thank you.
And we'll be continuing, Angie, Renee are continually in contact with AJ. So we always want to share what we learn from you with the nonprofit community. And, as these circles evolve or as more information comes available, we'll be able to send that out. So thank you so much, AJ. I'm sure you have a lot on your plate. We'll see you later.
Thanks
Bye.
for all you're doing. Take care.
Thanks. I did now want to invite our breakout host, and we can go to the next slide, to just share your video, please. And I've been doing my best here to assign everybody to their spot. So Cameron and Matt and Ann, if you wanted to share your video, that would be great. Welcome. Good morning. And I think we're still waiting on, I think I saw Cameron on here early. Oh, there he is. Awesome. Great. It's good to see you all. If you can, I'm going to unmute you for you. See if I can do that. Maybe. Just thinking about it. Oh, sorry. There we go. Now we're good. We're good. So as we did last week, we invited everybody to kind of add a number in front of their name and indicate which breakout room they feel is most relevant. But we'll just give you a quick opportunity to sort of kick off this discussion conversation starter here. And as I typed up this question yesterday, I realized what a tongue twister it was. So we're talking about like how in your organizations have you balanced conversations about risk, resiliency, and reimagining your organization's operations as we move through response and into recovery. So it's a lot of ours and kind of a lot there. So you can kind of break that up and maybe just let us know, where are you as an organization and determining, how are you going to be able to serve the community and keep your staff safe or your audience safe, or what are you thinking about at this time within your organizations?
Well, I can start. This is Matt with Iowa Stage. We're talking a lot about some of the things AJ was just saying in terms of how we know when we're past the peak. Obviously, for a theater company in the performing arts, we're very focused on what it looks like to get people together. And in terms of risk, we're not there's no earned income from our side right now. So we are completely reimagining what we're doing. We're adding video content. We're having conversations with other arts leaders that we're recording and sharing. We had a board meeting and a resident artist company meeting this week, turned into some great brainstorming around new ways we can try to engage with people until we can get back to doing theater again, which obviously we don't have any way to plan when that might be.
Yeah. Well, Matt, I know
so it's a complete.
Yeah, I know that.
Sorry, go ahead.
Oh, go ahead. We're really interested in holding space for arts and culture as part of, what we're doing in our community circle conversations, because, you are in a unique spot. And I'm going to just share to the chat box, I found an article in the New York Times last night about a Zoom call that 200 culture organizations are hosting in New York. And there's such a unique space for you guys. So thank you. And I'll move to Cameron.
Sure. Thanks, Brianne. At the Y, as you guys know, we're located throughout central Iowa, Polk, Warren County, Dallas County, Boone County, and the variety in which we provide services to the community ranges not just what people know us most for, which is the gym and swim, but we have a supportive housing campus that we have 140 residents that's been ongoing and making sure that our staff and those people are safe every single day has been a challenge for us that we welcome. But then also a residence camp in Boone, where we're grappling with what does summer look like for kids? How can we keep them safe? So those are things operationally we're looking at currently in the midst. And then finally, what people know us about is not finally, but just the fitness side of coming back into our buildings. And what does it look like from social distancing? What does it look like clean and sanitation? What does it look like to programs and services, amenities that our members can come back to, and just being real mindful that we have a social responsibility to make sure people are safe, that we adhere to the guidelines given to us by the governor, and in concert with our respective county health departments, which we've been in contact with. So we're developing our plans, but we're ready to pivot. And I think that's the key word that we've talked about as a team, is be ready to pivot and respond. Although we're closed, The Warren County was open, and we've taken our time to open the Indianola line because we want to make sure our members are safe and we can deliver on what's been mandated to us. And then also childcare and youth sports. We were grappling with those programs and services, suspending those services so groups can't gather. But when we come out of the recovery, to answer your question, in all of those areas, we have to figure out what does it look like for us, right? Mm-hmm. What does it look like to be in the space around childcare? How does the Y show up? What does it look like YMCA around youth sports? You know, we're sitting on every Zoom call we possibly can related to what does it look like to get kids in swim lessons, basketball, and those sorts of things. We're thinking through most of those things. Thanks, Grant.
Thanks. And Anne, just super briefly, because we'll want to zoom everybody out, and I know Dustin has a lot to go through. I know you guys have been really in the thick of it, so.
Yeah, we're really guided by a quote I read in an article in The Atlantic. It's called Our Pandemic Summer. And it was that everyone wants to know what's next and when we can get back to where we were, but it's the wrong question. The real question is, how do we continue? Our focus has been 100% on what's best for the families we serve. We serve families that have really strained bandwidth. And so looking at how can we adjust our work so that this ends up being a better deal for them. So that's where our focus has lied.
Okay, thank you so much. I'm going to give everybody the opportunity to zoom out here. It looks like folks, many of you are choosing to stay in the main room with Dustin, so hopefully we can work through his slides together. I'm going to open the rooms and we'll see you back here in a few minutes.